Welcome to Capsa, where we simplify complex medical and pharmaceutical topics to help you stay informed. My name is Sri and I am your educator for today's session. In this video, we are diving deep into Zestril, also known as Lisinopril, one of the most widely used medication for high blood pressure and heart failure. Together, we will cover its uses, how it works, its role in diabetic nephropathy, potential side effects, drug interactions, and many more. Whether you are a student, a healthcare professional, or someone looking to understand your medication better, this comprehensive video will provide you with all the details you need. So let's get started. Let's start with an overview of Zestril, also known as Lisinopril. Zestril belongs to the ACE inhibitor class of medications and has been a cornerstone therapy for managing hypertension, heart failure, and protecting kidneys, especially in diabetic patients. First introduced in 1987, Zestril quickly became popular due to its well documented efficacy and safety profile. It works by blocking the ACE enzyme, which lowers the levels of angiotensin II, a hormone that causes blood vessels to constrict. This results in lower blood pressure and improved the heart and kidney functions. Lisinopril or Zestril is primarily used to treat high blood pressure and heart failure. It's also a go-to medication for patients recovering from a heart attack. Another critical use is in protecting the kidneys in people with diabetes, a condition known as diabetic nephropathy. Additionally, lisinopril has some off-label uses like reducing protein in the urine and preventing migraines in certain cases. This versatility is part of what makes Gestrel such a valuable medication. The magic of Gestrel lies in its ability to block the angiotensin converting enzyme or ACE. By doing so, it reduces the production of angiotensin II, a hormone that causes blood vessels to constrict. This results in vasodilation or relaxation of the blood vessels, leading to lower blood pressure and less strain on the heart. Gestrel also reduces the production of aldosterone, a hormone that causes fluid retention, helping to prevent swelling and further lowering the blood pressure. Gestrel plays a critical role in protecting the kidneys, especially in patients with diabetes. It reduces the pressure inside glomeruli, the tiny filtering unit of the kidneys, preventing overwork and damage. This action also decreases proteinuria, a condition where protein leaks into the urine, often an early marker of kidney disease. By improving kidney blood flow and protecting small blood vessels from the harmful effects of high blood sugar, Gestrel helps delay or even prevent the progression of diabetic nephropathy. Gestrel is generally safe, but like all medications, it can cause side effects. The most common is a persistent dry cough, which, while harmless, can be annoying. Other mild side effects include dizziness, fatigue, and headaches. However, it's important to watch out for serious issues like angioedema, a rare condition causing severe swelling, or hypokalemia, which can affect your heart. Always consult your doctor if you experience unusual symptoms. A common side effect of Gestrel is a persistent dry cough. This happens because Gestrel increases bradykinin levels in the lungs, a substance that irritate the airway receptors. Although harmless, This cough can be frustrating for some patients. If it becomes intolerable, your doctor may recommend switching to a related class of drugs like ARBs, Losartan, which do not have this kind of side effect. In heart failure management, Zestril is often started with a low dose, around 2.5 to 5 mg daily. This approach helps the body adjust to the medication and minimizes the side effects like dizziness. Over time, the dose is gradually increased to a target range of 20 to 40 mg daily, depending on how well the patient responds and tolerates the drug. Gestrel can interact with several medications. For instance, NSAIDs like ibuprofen can reduce its effectiveness in lowering the blood pressure. Potassium supplements or diuretics can increase the risk of side effects such as high potassium levels or very low blood pressure. Always inform your doctor about all the medications you are taking before starting the Gestrel. When taking Gestrel, you need to watch your diet carefully. Foods high in potassium, such as bananas, orange, and spinach, should be limited as Gestrel already increases the potassium levels. Avoid salt substitutes containing potassium chloride and moderate your alcohol intake to prevent worsening side effects like dizziness or low blood pressure. Both Gestrel and Losartan are highly effective for managing blood pressure. Zestril is particularly beneficial for diabetic patients due to its superior kidney protection, and however, some patients experience a persistent dry cough with Zestril. In such cases, Losartan and ARBs is a great alternative with similar benefits but without the cough. Zestril comes with a black box warning, the FDA's most serious warning, due to its risk in pregnancy. It can harm an unborn baby by affecting the kidney development and other critical functions. If pregnancy is detected, Gestrel must be stopped immediately and alternative medications should be considered. Let's wrap up this session by answering some of the common questions about Gestrel or Lisinopril. So, can Lisinopril protect the kidney? Yes. Lisinopril helps protect the kidney by reducing the intraglomerular pressure, minimizing proteinuria, and preventing microvascular damage, especially in patients with diabetes. Is Lisinopril safe during the pregnancy? No. Lisinopril is not safe during the pregnancy. It carries a black box warning as it can harm or even kill an unborn baby. Discontinue immediately if pregnancy is detected. How long does lisinopril take to work for high blood pressure? Lisinopril starts working with a few hours, but it may take 2 to 4 weeks to see its full effect on blood pressure. What happens if I overdose on lisinopril? An overdose can cause severe low blood pressure, dizziness, fainting, and even kidney failure. Seek emergency medical help immediately. Can lisinopril cause weight gain or weight loss? Lisinopril is not directly associated with significant weight gain or weight loss. Any such changes are typically due to other factors or conditions. Can lisinopril lower protein in urine? Yes. Lisinopril is effective in reducing proteinuria, which is an early sign of kidney damage, particularly in diabetic patients. Why do I feel dizzy after taking lisinopril? Dizziness is a common side effect, especially when starting the medication. It occurs due to a sudden drop in blood pressure. Standing up slowly can help manage this symptom. Can lisinopril cause swelling or angioedema? Yes. Although rare, lisinopril can cause angioedema, which is a severe swelling of the face, lips, or throat. This requires immediate medical attention. What lab tests are needed while on lisinopril? Regular monitoring of kidney functions, potassium levels, and blood pressure is essential while taking lisinopril to ensure safety and effectiveness. How to safely stop taking lisinopril? Never stop lisinopril suddenly without consulting your doctor. Gradual tapering may be needed to avoid a sudden spike in blood pressure or other complications. Thank you for staying until the end of this video. I hope this session answered your questions and helped you understand Zestril better. Don't forget to like, share, and subscribe to Capsa for more informative content. See you in the next video.